Hello to you and welcome to Adelante Chicago. I'm Lourdes Duarte. Thank you so much for joining us today. Bienvenidos. Alarming new numbers indicate that in Chicago, HIV is on the rise with the highest proportion of cases reported among Hispanics. According to national data, HIV cases among Latinos grew by nearly 17% between 2020 and 2024, with Latinos making up nearly half of all cases in 2024. Now a call to action to reverse the disturbing trend. Medical reporter Dina Baer has more.
The message stands in plain view.
I will say a lot of the new cases that I've seen have been in Latino.
At St. Anthony, a hospital in the heart of the city's west side, Dr. Alfredo Menelora sees firsthand, after decades of progress, HIV cases are on the rise.
The way that this looks like for the frontline providers is that you may see more patients coming in with what we call advanced HIV or AIDS-defining lesions, or just increase in patients that are new to the diagnosis and require treatment.
The virus that causes AIDS is a silent disease at first.
So in that silent phase, which can last years, you can transmit it from person to person. Once the virus has affected your immune system to a high level, that's where you start getting more dangerous infections and symptoms.
The uptick in cases was noted following COVID, likely the result of less contact with healthcare providers and ultimately less testing. The same pattern was seen in other sexually transmitted diseases, but there is another factor at play.
Particularly in the Latino community, we had new arrivals that when you arrive to a new place, you may not have contact to healthcare, and therefore getting those services, getting tested and getting treated can make it more difficult.
For those diagnosed, powerful treatments called antiretrovirals prevent the progression and transmission of disease.
There's a phrase that we always tell our patients, which is that treatment is prevention. When we treat a patient with HIV, that person is less likely to give it to other folks.
PrEP, pre-exposure prophylaxis, is another critical tool.
We have an injection that can be given once every 2 months, and a new version that's once every 6. And that's practically like a flu shot, you know?
Roadblocks do exist, especially as federal funding fluctuates.
If we had access to that, broad access, we could really dent this issue.
Still, the message is stay optimistic and seek care.
We are ready to take care of patients, and we're excited to use these tools.
All right, and that was our Dina Baer reporting. Organizations like ALMA Chicago are instrumental in promoting prevention and treatment to reduce the spread of HIV within the Latino community. And so here to talk to us about this and how they do that is Manuel Hernandez. He is the executive director of ALMA Chicago. Welcome. Thank you so much for being here with us. Such an important topic.
Yes, absolutely. Thank you for having me.
Of course, and we'll get into what ALMA is, what it does, but I want you to explain, as somebody who is on the ground talking to folks in neighborhoods, what are you seeing? What has the evolution of HIV cases been like recently?
Yeah, what's really going on and what's really interesting is that oftentimes these conversations aren't being had in communities. Okay. Even our communities where we're most impacted, it's still kind of hush, don't talk about that. Or there's oftentimes like, yeah, your Theo, you know, he's sick. But that's as far as the conversation goes, even though we're seeing individuals, especially Latina communities, that have increased rates of housing insecurity, food insecurity, access to healthcare that's competent, that's culturally competent and linguistically accessible is oftentimes the barrier that many in our communities are facing.
Okay, and we heard the doctor in this story talk about the rise in cases in terms of a rise in a percentage from, you know, compared to maybe, let's say, 5 years ago. What have those levels been like?
Yes, they've spiked quite dramatically over the past few years. You know, AIDS Foundation Chicago came out with a report that has preliminary data of 2024, and it showed that Black and Latino men made up more than 80% of new cases in Chicago. Okay. And Latino men make up about 70% of new cases. So we have seen an increase. We saw the increase right after the pandemic or right after lockdown when folks were being able to access medical care. We saw an increase, and then we saw a decrease the following year. And then the subsequent 2 years they would spend.
And I would imagine, I mean, Chicago being such a big city, obviously you see those trends, but I imagine other major cities, New York, Los Angeles, are you seeing the same amount, the same numbers?
Absolutely, we are seeing that across the board. We have seen for other communities a decrease or stabilization in new HIV infection rates, but among Black and Latino men, there has been a substantial increase throughout the U.S., especially in kind of major cities,
metropolitan
and in the
areas. Yeah, so it's not just unique to Chicago.
Correct.
And you mentioned housing affordability, housing insecurity. What do you attribute these changes to? Is that the main problem?
I would say it's part of it. It's hard to pinpoint one reason that this is that's resulting in increased numbers, but really an approach to the HIV epidemic has to be holistic. When you see an increase in housing insecurity and access to healthcare, you also see an increase to preventable diseases as well as kind of communal diseases.
Yeah, you know, it's so interesting that for a long time, it seems like people had really sort of forgotten about HIV or maybe it wasn't getting as much attention because the numbers were trending downward.
Right.
And now to see that spike, I imagine now it becomes much harder to fight for those added dollars because some of those resources had been lost. Is that what you're seeing?
Absolutely. And the organizations that are doing this work, that are helping community members navigate the space of finding a doctor, getting testing, and prevention, right? PrEP is also available, especially in the state of Illinois where it's free to get PrEP, isn't necessarily accessible to the communities that need it the most because the material isn't in a language that's understood or is using language that oftentimes create a different image in our heads. Something that comes to mind immediately is there's a flyer for some healthcare and it says for residents only. That can mean something very different of someone of immigrant experience. And so being mindful of the language we're using in communities, that allows community members to then access the resources.
Let's talk a little bit about ALMA and the role that you play in making sure those numbers decrease. So talk to me about the sort of help that people can walk into your organization and receive.
Yes, so first thing is at ALMA, we help community members to access those critical services that they do need. I handle most of them directly myself. A person calling me or sending me an email, they're looking for legal support or they're looking for health services.
So it's not just when it comes to HIV cases.
Correct. Correct. And so we provide support for individuals for all aspects that will affect their health outcomes. We know that immigration status and being able to talk to someone in confidence is extremely important. We know that having access to housing, stable housing, or having access to healthcare all play a role in a person's HIV status when it comes to prevention, but also when it comes to treatment of their condition as well.
Yeah.
And so they come to us seeking those services, and I connect them to the institutions and to the organizations that can help them and provide those services.
It makes me smile that the executive director of this organization is sort of holding people's hand along the way. So to say that you firsthand, you will treat each case and will talk to people individually, that's incredible.
Absolutely, and it's rooted in the humanity of people. You coming to our doors, you're not just a number of like, okay, I get to report out one more person we helped, but it is seeing you through, because oftentimes that gap in referrals and connections is where folks drop off. And with something as important as your health, I target and I'm like, nope. It's affected my family, it's affected people that I'm close with, and so I know how difficult this can be.
Absolutely.
So I'll help you through the process, even if it means that I'm getting a little bit less sleep, or I have to focus, I gotta change my direction for things. But I'm there to really support our community.
You're walking with people along the way, which is so important. Okay, the information on the screen, we'll have it, almachicago.org. You can go there, find out how to get in touch with you, and of course, some of the resources that they have to offer. Thank you so much.
Thank you so much.